For many people over 60, sleeping face down or with the body twisted feels familiar, almost comforting, because it has been repeated for decades without obvious consequence. Yet the body does not forget what it endures for hours each night. When the head is rotated to one side and the torso is pressed into the mattress, the cervical spine is forced into an unnatural position that restricts blood flow and compresses delicate nerve pathways. Muscles along the neck and upper back remain partially contracted to protect the joints, preventing full relaxation. Over time, this nightly strain accumulates, not as a dramatic injury, but as chronic stiffness, morning headaches, or a persistent sense of tension that seems to have no clear cause. From a biomechanical perspective, the spine is designed to maintain gentle curves that distribute load evenly. Twisted or prone sleeping positions flatten or exaggerate these curves, forcing ligaments and connective tissues to absorb stress for prolonged periods. After 60, these tissues lose some elasticity and recover more slowly, meaning that what the body could once tolerate now becomes a source of irritation. The nervous system senses this distortion as instability and responds by increasing muscle tone, even during sleep. This elevated tone keeps the body from entering deeper, more restorative sleep stages, subtly reducing the quality of rest without fully waking the sleeper. Breathing mechanics are also affected in these positions. Lying face down restricts the expansion of the rib cage and diaphragm, leading to shallower breaths and reduced oxygen exchange. Over hours, this can mildly elevate carbon dioxide levels, signaling the brain to remain more alert than relaxed. The result is sleep that feels long in duration but incomplete in effect. People often wake feeling unrested, even after a full night in bed, attributing the sensation to age rather than to the mechanical limitations imposed by posture. There is also a circulatory consequence. Twisted positions compress blood vessels, particularly around the shoulders, hips, and neck. Reduced circulation during sleep slows the delivery of nutrients and oxygen to tissues that rely on nighttime repair. This is especially relevant for older adults, whose vascular systems are already adapting to age-related changes. Restricted blood flow can contribute to numbness, tingling, or joint stiffness upon waking, reinforcing the perception that the body is becoming fragile, when in reality it is responding logically to sustained compression. Neurologically, the body interprets prolonged twisting as a form of low-level threat. The brain's protective systems remain partially engaged, limiting full parasympathetic activation, which is essential for deep healing and hormonal regulation. Growth hormone release, tissue repair, and immune modulation are all influenced by sleep depth. When posture interferes with relaxation, these processes become less efficient. The body may still rest, but it does not fully restore. Psychologically, habitual discomfort during sleep subtly alters one's relationship with rest itself. Sleep becomes something to endure rather than a place of recovery. This can lead to increased sensitivity to discomfort and a heightened awareness of bodily sensations during the day. Over time, the individual may move less confidently, not because of weakness, but because the body has learned to associate certain positions and movements with strain. When these patterns persist, they create a feedback loop. Poor alignment leads to tension, tension disrupts sleep quality, and disrupted sleep reduces the body's ability to repair alignment-related stress. Breaking this loop begins with awareness. Recognizing that familiar does not always mean supportive allows the body to gradually relearn what true rest feels like. By shifting away from twisted or face-down positions, the spine is given permission to return to neutrality, muscles are allowed to soften, and the nervous system receives a quiet message of safety that supports deeper, more restorative sleep and a calmer waking state the next day. Lying flat on the back without proper support may seem like the most neutral or natural position, but for adults over 60, this posture carries subtle yet significant consequences for breathing, spinal alignment, and overall physiological restoration. The human body relies on gentle curves and precise alignment to distribute force evenly, and when the back is completely flat against a mattress, the natural lumbar curve is often flattened or unsupported. Over time, this can increase pressure on the intervertebral discs, causing them to bear more load than they are designed to handle during rest. This subtle compression may contribute to lower back stiffness or discomfort that is often blamed on age rather than mechanical positioning. Breathing is particularly influenced by this posture. As the soft tissues of the throat and airway relax during sleep, gravity can allow the tongue and surrounding tissues to partially obstruct airflow, particularly in older adults whose muscle tone in the airway has decreased. Shallow, interrupted breathing may go unnoticed because it rarely causes full awakenings, yet the body senses it. The brain and cardiovascular system respond by subtly raising sympathetic activity to compensate for reduced oxygenation, leading to less restful sleep and a heightened state of physiological vigilance even during unconscious hours. Over time, these small adjustments can increase the risk of daytime fatigue, mild cardiovascular stress, and reduced efficiency of restorative processes such as tissue repair and hormonal regulation. The position of the arms, legs, and head while lying on the back also affects spinal rotation and joint comfort. Without proper support, shoulders may rotate forward, neck may hyperextend or flex awkwardly, and hips may tilt, creating imbalances that persist after waking. Even subtle asymmetries can trigger the nervous system to maintain partial muscular contraction throughout the night. Muscles of the back, neck, and hips remain slightly engaged to stabilize these joints, preventing full relaxation and limiting deep, regenerative sleep stages. Over time, this can manifest as morning stiffness, persistent fatigue, or a generalized feeling of tightness that is often dismissed as normal aging. Circulation is another factor influenced by this seemingly simple position. Flat lying posture without elevation of the head or support under the knees can allow gravity to create uneven pressure on veins and arteries, particularly in the lower extremities. Reduced venous return may increase swelling or the sensation of heaviness in the legs, particularly in adults who already experience mild age-related changes in vascular elasticity. Suboptimal circulation can also reduce the delivery of nutrients and oxygen to tissues that rely on restorative blood flow overnight, slightly impairing cellular repair mechanisms. Neurologically, flat-lying sleep may limit the body's ability to signal safety and relaxation when airway obstruction or spinal tension persists. The parasympathetic nervous system, responsible for lowering heart rate and promoting digestion and repair, becomes less dominant when subtle stressors remain active. As a result, the body may not fully reach the deepest stages of slow-wave sleep, which are essential for hormone regulation, memory consolidation, and tissue recovery. Over weeks and months, this can diminish overall resilience, even though the individual is technically getting a full night of rest. Psychologically, awareness of restricted or shallow breathing, stiffness, or restlessness may subtly alter one's approach to sleep. Over time, lying flat may become associated with discomfort, prompting habitual adjustments during the night that fragment rest. This can reinforce the perception that sleep is less restorative after 60, although much of the issue originates from the mechanical and physiological consequences of the posture itself rather than the mere passage of time. When these cumulative effects are understood, small adjustments such as slight torso elevation with a pillow, lumbar support, or proper head alignment can dramatically improve breathing, reduce spinal stress, and signal to the nervous system that it is safe to enter deep rest. The body's internal feedback loops respond rapidly to these changes, illustrating that even subtle mechanical interventions during sleep can profoundly influence quality, recovery, and overall health for older adults. Curling tightly in a fetal position or tucking the limbs under the body is a posture that feels cozy and protective, almost instinctively comforting. For decades, many people have relied on this familiar position to feel secure as they drift into sleep. Yet, for adults over 60, this habitual posture subtly disrupts alignment, joint mechanics, and circulation in ways that can accumulate tension over years without being consciously noticed. When the hips and knees are sharply flexed and tucked inward, the pelvis rotates forward slightly, altering the natural curves of the spine. The shoulders often round forward to accommodate the compacted form, creating asymmetries that the muscles must compensate for throughout the night. Although these adjustments are minor moment to moment, repeated thousands of times over months and years, they gradually produce residual stiffness and a sense of heaviness in the joints, particularly in the hips, lower back, and shoulders. From a biomechanical perspective, compression in this posture limits the ability of connective tissues to relax fully. Ligaments and tendons surrounding the hips and knees are shortened for extended periods, and the nervous system interprets this compression as a mild stress signal. As a result, the muscles surrounding these joints maintain partial activation, preventing the full release that allows tissues to repair and recover. The tension experienced is often subtle and unnoticed during sleep but becomes apparent upon waking as soreness, tightness, or a feeling of restricted movement. The chronicity of this stress can reinforce age-related discomfort, leading many older adults to assume stiffness is an inevitable consequence of aging rather than the result of long-term mechanical patterns during rest. Circulation is also affected in this position. Tight bending at the hips and knees slightly compresses veins and arteries, reducing venous return from the lower limbs and limiting nutrient-rich blood flow to muscles and connective tissues. Over time, this can contribute to a feeling of heaviness, mild swelling, or reduced tissue oxygenation. Even if the effects are subtle, they influence the body's overnight recovery processes. Cellular repair, tissue regeneration, and waste removal all rely on efficient circulation, meaning that habitual curling in a constrained posture can interfere with the restorative potential of sleep at a cellular level. Breathing mechanics are subtly altered as well. The tight, compact posture restricts the expansion of the rib cage and diaphragm, leading to shallower breaths. Although this may not cause noticeable awakenings, it can affect oxygen delivery and carbon dioxide removal during deep sleep cycles. Shallow breathing subtly signals the nervous system that the body is in a partially alert state, reducing parasympathetic dominance and slowing the processes of repair, growth hormone release, and immune regulation that occur most effectively during deep, restorative sleep. Over time, these mechanical and physiological consequences influence how the brain perceives movement and comfort during waking hours. When the body experiences repeated compression and subtle tension overnight, it carries that residual tightness into daily activities. Hips, knees, and shoulders may feel less mobile, and the nervous system may unconsciously limit the range of motion to avoid discomfort. This can reinforce patterns of caution in movement, reduced flexibility, and a sense of fragility that is not intrinsic to age but rather learned through repeated postural stress. Psychologically, curling tightly in bed can also reinforce a sense of protection or guardedness. The body is learning through habit to seek comfort in constriction rather than expansion. In contrast, adopting positions that allow gentle alignment and natural expansion of the limbs communicates to the nervous system that the body is supported, safe, and able to relax fully. The shift from tension to ease requires conscious attention and small adjustments, but the impact on both sleep quality and overall functional movement is profound. Over weeks and months, these adjustments allow joints to move more freely, muscles to release tension, and circulation to improve, creating a cumulative effect that enhances morning mobility, reduces stiffness, and allows the body to recover more fully each night. Even seemingly small habits, such as draping an arm over a pillow or sleeping with the neck slightly twisted, can have a surprisingly profound impact on the musculoskeletal system and the nervous system, particularly for adults over 60. When the shoulders are elevated or rotated awkwardly, the muscles surrounding the scapula and upper back remain partially contracted throughout the night, even during unconscious hours. This low-level engagement may not wake the sleeper, but it prevents complete muscular relaxation. Over time, these subtle patterns of tension accumulate, creating stiffness in the neck, shoulders, and upper back that can persist into the waking hours. The body interprets these sustained postural strains as signals of instability, prompting the nervous system to maintain heightened alertness even during sleep. The nervous system is continuously monitoring the body's structural integrity. It interprets misalignment or uneven loading as potential risk, increasing muscle tone to protect joints and soft tissues. In older adults, who may already experience diminished proprioceptive feedback and slower recovery of connective tissue, these protective responses can become chronic. Muscles that should be fully relaxed during rest remain partially engaged, and the body remains in a state of low-grade tension. This tension not only affects sleep quality but also carries into the day, influencing posture, movement confidence, and overall comfort. Even minor misalignments can have cascading effects. Tight neck and shoulder muscles may affect the upper spine, altering breathing patterns, while compensatory activation in the lower back can contribute to stiffness and discomfort in the hips. Sleep posture also interacts directly with respiratory efficiency. When the head, neck, or shoulders are positioned awkwardly, the rib cage and diaphragm may be restricted, limiting the depth of each breath. Shallow breathing sends subtle signals of stress to the nervous system, preventing full parasympathetic dominance that is necessary for deep restorative sleep. Without complete relaxation of the nervous system, the body cannot fully engage in tissue repair, immune regulation, or hormone release. Over time, this combination of mechanical restriction and heightened neural alertness undermines the restorative potential of sleep and can contribute to daytime fatigue or difficulty recovering from minor physical exertion. The positioning of the limbs further contributes to stress patterns. An arm tucked under a pillow or bent awkwardly can compress nerves or blood vessels, creating mild numbness or tingling that the body perceives as threat. Even if the sensation is brief or unnoticed, the nervous system responds by maintaining partial contraction in surrounding muscles, reinforcing tension throughout the night. For older adults, repeated micro-stressors like these can accumulate over years, subtly limiting flexibility and range of motion, and reinforcing the perception that stiffness and discomfort are simply a natural part of aging. Psychologically, chronic low-level tension during sleep can shape expectations about rest and movement. When the body repeatedly experiences small constraints or discomfort, the brain begins to anticipate difficulty, influencing waking behavior. People may move more cautiously, restrict joint range, or avoid activities that feel unfamiliar, all because the nervous system has learned to expect strain rather than ease. This relationship between habitual sleep posture and daily movement demonstrates how unconscious patterns reinforce both physical and mental perceptions of limitation, particularly after 60. Adjusting these small positional habits communicates safety to the nervous system. By adopting a side sleeping position with neutral spinal alignment, gentle support for the head and arms, and minimal rotation of the neck, the body experiences alignment that encourages relaxation. Muscles can release fully, breathing becomes deeper and more rhythmic, and the nervous system receives clear feedback that it is safe to enter restorative stages of sleep. Over time, this recalibration reduces overnight tension, enhances circulation, and improves tissue repair. The cumulative effect of small adjustments in arm and shoulder position can transform not only sleep quality but also waking comfort, posture, and movement confidence, creating a foundation of ease that supports functional health and overall well-being in later life. When we consider the quality of sleep after 60, it is easy to focus solely on the body's mechanics, joint alignment, or breathing patterns. Yet one of the most powerful aspects of rest lies in the sense of confidence and trust we have in our bodies while lying down. When the body feels supported in a neutral, comfortable position, the nervous system recognizes safety, allowing full parasympathetic activation and deep restorative sleep. Conversely, when habitual positions create subtle misalignment, compression, or tension, the nervous system remains partially vigilant, interpreting the situation as a mild threat. Over time, this chronic low-level stress can shape not only sleep quality but also daily perception of mobility, ease, and physical capability. The sense of trust begins in the hips, spine, and shoulders. When these areas are properly aligned and supported during rest, the glute muscles, core, and postural stabilizers can fully relax. The nervous system interprets this as structural reliability, a signal that the body can operate safely without guarding. This allows muscle fibers to release tension, blood flow to increase, and joints to decompress subtly. As sleep progresses, this foundational trust encourages deeper stages of restorative sleep, where hormonal balance, tissue repair, and immune function are optimized. When the body feels unsafe or unsupported, however, protective tension remains in place, preventing full entry into these vital phases. Beyond the physical restoration, confidence in posture also influences waking behavior. Adults over 60 often approach movement cautiously due to prior discomfort or fear of injury. When the body experiences repeated nights of stable, supported alignment, the nervous system gradually recalibrates, updating its perception of what is safe. This recalibration reduces anticipatory tension, allowing limbs to move more freely and posture to align naturally during walking, standing, or bending. Individuals report feeling lighter, more coordinated, and less hesitant in everyday activities, not because strength has magically returned, but because the nervous system has learned to trust the structural integrity of the body. Psychological factors intertwine with these physical processes. The repeated experience of safe, comfortable sleep builds a sense of agency, signaling that one's body can respond reliably to effort without unexpected pain or fatigue. This enhances confidence in movement and encourages active engagement with the world. Over time, it reshapes mindset as much as musculoskeletal function, replacing subtle fear and hesitancy with assurance and curiosity. Even activities previously avoided due to discomfort, such as reaching overhead, bending, or walking briskly, become approachable because the body has internally reinforced its own capacity to support itself. Circulation and metabolic function also benefit from this state of trust. When muscles can relax fully, venous return improves, and oxygen-rich blood reaches tissues more effectively. Nutrient delivery to muscles and connective tissue is optimized, supporting repair and resilience. Hormonal signals, including growth hormone and melatonin, are enhanced in deep sleep, reinforcing tissue regeneration and overall vitality. This combination of neurological reassurance, mechanical alignment, and metabolic efficiency creates a feedback loop. Confident, supported sleep improves physical readiness, which in turn encourages further safe movement, strengthening, and functional independence during the day. Ultimately, the return of confidence and trust in one's own body is a profound benefit of aligning posture and sleep mechanics correctly. The body ceases to interpret resting positions as threatening, muscles release tension, breathing deepens, and the nervous system communicates a message of safety. Over weeks and months, these adaptations build a foundation of ease that extends far beyond the bed. Walking feels lighter, bending feels controlled, and the individual moves through life with greater fluidity, balance, and assurance. In this way, proper sleep posture does more than prevent discomfort, it reshapes the relationship between the body and the mind, creating a sense of empowerment that reinforces healthy aging, mobility, and overall well-being. If you found these insights helpful and want to continue learning practical, science-backed strategies to stay healthy, strong, and vibrant as you age, don't forget to like this video, share it with friends and family who could benefit, and subscribe to our channel for daily senior wellness tips, nutrition guidance, and simple lifestyle hacks designed to enhance longevity and quality of life. Hit the notification bell so you never miss a new video that can help you live healthier, happier, and more empowered every day.